Hello and welcome to On the Record, a debate-style television talk show where Bahamians will find the balanced, true and open debate they've been looking for. We have all been the recipients of or participated in the weekend medical fundraiser at some point, an endless stream of tickets in aid of. A single medical episode or accident has wiped out the finances of countless Bahamians and left many more at the mercy of the charity of family, friends, and anyone simply willing to help. At the same time, the public health care facilities are overrun with people unable to afford private medical care. Bahamians have found themselves in the fight of their lives just to simply try and stay alive. But what do we do? Just recently, the government bought yet another scheme to provide national health insurance, this time asking the working populace to pay 2% of their salaries into an insurance scheme to cover primary health care and certain procedures. Tonight, we try to understand what is being proposed, who will benefit and how. It's all about national health insurance, the fight to stay alive. It's all on the record. I'm your host, Jerome Sawyer. Our discussion begins on the other side of this break.
On the Record is brought to you by Alive, the nation's newest and best LTE network.
Good to be alive.
My name is Regilio Bethel. My position on board Equinox is mate, relief captain. I must say that during our travels and journeys throughout the Exuma Keys, we've had a few dark or dead spots. Basically, there was no service. They were just dark spots. We would basically be dead ship out in the cold without any communication. And it's been like that for years, and we've gotten used to it. But Alive has now provided us with a service which we can stay communicated during our entire voyages. And I've been waiting for Alive to bring their service up to full more coverage throughout the Bahamas, which they've done in an amazing amount of time. Yeah, I would encourage them all to get that service. It's an awesome service, no interruptions, and it's awesome.
Are you afraid to swipe your card and you don't like to carry cash? If so, you need checks. Executive Printers can make checks for all your needs. They have laser checks, personal checks, continuous checks, and more. All checks have up to 15 security features, so you know you'll be protected. You can even customize your checks. Come and see one of our experts today, or log on to epbahamas.com for more info.
And welcome to On the Record. My guests tonight are Dr. Robin Roberts, Chairman of the National Health Insurance Authority Board, and Graham Whitmar. She's the Managing Director of NHI. Gentlemen, welcome to the show. Thank you for being here. We have a lot to talk about tonight. The issue of national health insurance took center stage nearly 2 weeks ago when the proposal was announced to begin the consultative process. Here's a look at where we are.
The idea of national health insurance has been a part of our national discourse for the past 4 decades. And for every government that's tried to find a way to fund the astronomical cost of caring for Bahamians, they've been left holding a political hot potato. This time is no different. The National Health Insurance Authority recently made public a policy paper which proposes a 2% payroll tax to fund universal health care. The policy paper, called National Health Insurance, a Shared Responsibility, suggests a salary deduction for anyone working 15 hours or more weekly at a split in payments between employees and employers. Workers could pay anywhere from $17 to $42 monthly, with employers paying the remainder.
Well, I think the way I think Bahamians want to know is how much this is going to cost me. What's coming out of my pocket? So we're very prudent in this. We have, from our calculations, we're looking at Bahamians who earn at least what we consider the general average salary in this country. They would pay no more than $42 per month.
Barely settled with the increase in value-added tax a few months ago, the public pushed back hard.
This time, I don't think we should have another tax on the country because 12% just implement last year and bring another tax on the poor people it's ridiculous.
We already paying 12%. We don't need no more tax because it's not fair in the eyes of God or in the eyes of men. Because they come to put more tax on you. Mind me days of Solomon. The father put one on you and the son come and make it heavier. Now what we going to do in times like these? We need Jesus.
2 days later, the Prime Minister puts on the brakes, saying it's not set in stone. The Cabinet was still awaiting a final report from the NHIA and promised full public consultations. But rewind to 2015. A then opposition leader, Dr. Hubert Minnis, rejected an NHI tax by the Christie administration, citing that a tax would increase poverty and possibly decrease the quality of living and health care. The next 6 to 8 weeks will give the public a chance to weigh in on the proposals. Meanwhile, the public healthcare facilities remain overwhelmed. Medical staff taking industrial action over pay and conditions, and healthcare costs continuing to rack up.
Every year we see about 55 to 60,000 patients.
In that space?
In that space. 55 to 60,000 patients. It's one of the busiest emergency rooms around. We collect less than $200,000.
From 50 to 60,000 people?
From
less than 200,000?
Let's say 55,000 people.
Wow.
So that works out to $3 per patient collected. Now these are people with gunshot wounds, stab wounds, heart attacks, strokes, etc.
$3 per patient?
$3 per patient. So it actually costs us more to pay for the registration staff and the collection of money than we collect.
Meanwhile, the opposition, which first attempted to introduce the scheme prior to the May 2017 election, has come out vowing not to support a payroll tax to fund the scheme.
Well, gentlemen, that encapsulates where we are up to this point. Again, happy to have you with us. First of all, let's talk about the authority itself, National Health Insurance Authority. What is that authority? What are you mandated to do? And really tell us briefly about the work that you are have already undertaken.
The National Health Insurance Authority is established by law with a board to be in charge, and I've been honored to be the chairman of that board. And that board reflects all the stakeholders in this society that have an interest in healthcare. We're looking at the doctors, the nurses, civil society, the insurance companies, the business community, the young, the old. We also have representation in the ex officio capacity. We are looking at the chief medical officer, the insurance commission person in charge. We have social services. And so we think that we are reflecting the concerns and the needs of the population. That's the first thing. The second thing, in a nutshell, we have been charged to design and to implement a national health insurance program that is a means of funding to provide the best cost-effective care that we can have that will impact all residents in this country.
Why is it that we cannot continue business as usual when it comes to healthcare costs and trying to fund these costs and look after our people?
That's the simplest question in the world to answer. We just cannot afford it. You can look at the individuals. The best example of that is one of the members on our board. They say that, Dr. Roberts, when I get my $1,000 premium, my $1,000 pension, I have to put $800 in my pocket, and I have to now take the $1,800 to pay for my private insurance premium, and that excludes my wife. That's a luxury that the average Bahamian doesn't have when they retire. They also retire their insurance premium because the jump just goes up. The government in the past 12 years has doubled the amount of monies that they've spent in health care and trying to provide better care for the people. The Minister of Health tells us the great deficiencies, some $50 million or so, that we need in order to meet the deficit spending, and that projects towards lack of services and maintenance. But more importantly, we have this onslaught of the non-communicable diseases that's upon us. With regards to, we have the highest incidence of obesity in the world. We have one of the highest incidence of diabetes in the world. We have a high incidence of hypertension. We have our violence is unprecedented in the country, and that's
not even the cancer.
And that's not even the cancer discussions.
Yeah.
So therefore, there's a tsunami coming down the road, and which, my God, if we don't find a way in which we can not only prevent what's happening, but also to pay for what has happened. And that is exactly what this National Health Insurance Plan is set out to do.
So I want to talk about sort of the calculation and the ratio. You're talking about 2% on salary, employer will pay the. How was that determined and why just the 2%?
Well, we took a look at the incomes of the Bahamian people, and we wanted to find something that was affordable both for the employers and the employees. And we thought, we started from a basic belief that everybody should contribute something, and there's many players that are going to contribute to the proposed NHI plan, and one of those is the employees that will benefit from getting access to what we call the standard health benefit package of benefits that you've described. And so we looked at the median income, the average income at around $25,000, and we said, well, when someone gets to that point, we think it's kind of fair that they are 50-50 with their employer, so they would pay $42 a year. But people on lower income...
42 a month.
42 a month, I beg your pardon. But people on lower incomes, they should still contribute, but they should contribute something less, because clearly they're not able to afford the same level. So somebody on minimum wage, we calculate, will contribute about $17 a month, and someone who's part-time, maybe earning $5,000 a year, they would contribute $8 a month. So it's trying to reflect the fact that different people have a different ability to afford it, and what they're getting, we think, is a reasonably comprehensive and affordable package of meaningful benefits.
Let's talk about the benefits. You talk about primary health care. What constitutes primary care?
Yeah, well, I'm glad you asked that question. There are basically two sets of benefits we're looking at. The first set of benefits in national health insurance was primary care, and that is to assure that every Bahamian has a doctor that they can visit when they need, I would say, urgent care. They know that someone who's going to look after their high blood pressure and so forth. And we also hope that they will continue to see them on an ongoing basis and assist in coordinating their care. When you start to look at what we call primary care in itself, as mandated by the World Health Organization, there are so many people that have no access to a doctor. In fact, in primary care, you don't have to have a doctor. You could have a community person that's well versed in health, someone who is going to introduce you and guide you to the healthcare system. What we want to do is look at primary health care. So we are looking at a system of delivery of care in the community, which goes beyond just seeing the doctor. It goes towards healthcare education, health prevention, health promotion, wellness program that you're not only ongoing through your lifespan, but also for the family, and also to coordinate all your care.
Now, what about? I know that there is also.
Secondly, so the primary care. So we expanding the primary care.
Right.
The second thing we're doing is, for the first time, we are looking at high cost care, what is chronic care.
That was my next
care
question.
that's going to as almost 60% of Americans go bankrupt. It's a care in which almost 50% of Bahamians say that I've assisted somebody of being involved in those cookouts that you're talking about. Now, we've looked at those common conditions. Healthcare is very expensive. We can't afford all. Right. So we looked at those which were most common. We look at the serious epidemiological data.
Give me some examples.
We looked at cancer, first and foremost. We look at the common cancers in women: cancer of the breast, cancer of the cervix, prostate cancer. In both men and women, we have colon cancer. Okay. We look at renal disease. We have an inordinate amount of Bahamians who are end-stage renal failure. They need to go on dialysis, and it's costing them to the tune of up to $75,000.
And when
a
you
year.
consider what has even been happening within the dialysis unit, I mean, that in itself
Absolutely.
is scary. Okay,
Get,
go on,
no,
sir.
I'm going on. Then we look at the next common disease with all our hypertension, diabetes, atherosclerosis. We're looking at heart attacks.
Okay.
So we're looking to say that now the average person who comes to the Princess Margaret Hospital right now, we don't have anything in terms of interventional cardiology we talk about, in terms of doing the angiograms or the diagnostic procedures to see where the damage is in the heart. We don't have the capacity to do open heart surgery. We don't have the capacity to do even the minimal interventional procedures, the so-called stents. So we're looking at aspects related to that will be covered. And then we also realize that there's a condition in people who have heart problems where your heart might stop beating. And so we're looking at pacemakers. So we'll have those available. So we're looking at those very common but critical conditions.
Will it cover things like if I need an X-ray or blood work or things of that nature? These are the things that rack up in cost.
Two things I want to tell you. First of all, our primary care package includes laboratory diagnostics, the blood tests, and it includes certain imaging procedures, particularly ultrasounds. So it means more so that when we expand for women who are pregnant, that they will get the ultrasounds that they will need during that pregnancy, because we'll also have them as a part of our primary care package. Okay? And then we have to realize that when we come to the services, every entity in the international community with regards to funding healthcare, make it very clear that if you want to have national health insurance that's affordable and sustainable and realistic, you have to invest in your public healthcare system. We have made major investment in our public healthcare system, particularly when we look at our tertiary care centers in Princess Margaret Hospital. So, and people have to realize that the fees that we have now are nominal fees. They only pay maybe at most 5%.
When the Minister of Health was here, he and I talked about
so therefore,
very low.
So therefore, what we are looking at is right now, all of those other procedures in the Princess Margaret Hospital, you're essentially getting it free. In fact, I'm going further. We are recommending to the government, because one of the pillars of the World Health Organization with regards to universal coverage is removal of all out-of-pocket payments. So what we are saying to the government, that the 5% that you collect isn't worth the headache, it isn't worth the hassle, and it isn't worth the deterrence from people who can't afford care. So therefore, if you are enrolled in National Health Insurance Program, you are paid up.
Okay.
So when you come to the service, all those other terms that you're talking about, they're already covered.
I have to ask this question as well. I'm going to use myself as an example. I have private insurance, which is astronomical, I have to say. I mean, I always tell people my insurance is the largest bill in my life, outside of maybe mortgage or something like that. But how will I now be affected, and others like me who may be in a private health insurance through their jobs or some other situation? What does this mean for me?
Well, nothing we're doing is going to cause those individuals to lose their coverage. We actually believe that this is an opportunity to strengthen that coverage, and we hope that we can actually make it more cost effective, because as we've been around, we've talked to a lot of individuals and a lot of businesses, and the single thing they ask us is, can private health insurance be made more affordable? So what will happen is that your policy and everybody else that has a private health policy will have to cover the standard benefits that we've proposed, and we propose that those benefits have no co-pays and no deductibles, and the conditions that we cover are not treated as pre-existing conditions, and that will strengthen your policy around the conditions that are in the standard health benefit. But you will still be able to purchase additional benefits that may give you more options for choice, even choice for care overseas. That'll be a decision you make or a decision your employer makes to offer a plan to you. So in principle, we think that this will strengthen the existing healthcare plans, and because NHI will be a catalyst for change in the system, we think it can also play a significant role in helping manage the costs of private health insurance. And indeed, this is something we have been talking to the private health insurance industry about.
Gentlemen, we have to take a quick break here, but when I come back, one of the things I do want to address is pre-existing conditions and how that will work. I mean, you talked about the fact that, we are so unhealthy as a people. We are presenting large amounts of people who are going to come to this scheme with conditions. I want to talk about that and much more when we return. More on The Record right after this break.
Hi, I'm here to tell you about the fastest way to purchase the vehicle you want right from home.
With SBT Japan, we import used cars from Japan straight to you.
Car ownership doesn't have to be hard. Go to sbtjapan.com and sign up for free. Search for the car you want, place your order, and make a payment using any one of our convenient payment options. Once you pay the duty and tax to our in-house broker, we will clear the vehicle and even deliver it straight to your home. Sounds too easy? Well, shouldn't it be?
Like lamps, plants, ceiling fans, edgy artwork, LED security lights, lawn furniture, mattresses, pillows, loads of refrigerators, power tools, appliances. Come visit our recently expanded showroom, conveniently located on Tunique Williams Darling Highway Roundabout. Eagle, best quality, best price, guaranteed.
I'm Davriel here with Rev Tips, where we answer your most important Rev service questions. Today's question is, how can I control my TV volume using my Rev remote? Here's how. Press the cable button and OK button simultaneously until your cable button lights up. Press your volume up button once. Your cable button light should flash. Once your cable button light flashes, press cable once. Enjoy your Rev TV experience. Simple, right? Be sure to join us next time.
This portion of On the Record is brought to you by Generali Insurance Company Limited, your employee benefits specialists.
The National Health Insurance proposal is asking for 2% of salaries of all employed individuals to go towards a national health care policy. The health minister says this private-public partnership will rely on the private sector to issue policies and operate the scheme under the regulatory oversight from the NHI Authority. National Health Insurance Fight to Stay Alive is my topic tonight. My guest, Dr. Robin Roberts, Chairman of the National Health Insurance Authority Board, and Graham Whitmart, Managing Director of NHI. As we went into the break, I was asking about pre-existing conditions. I mean, it is no secret we have high incidences of hypertension, heart disease, diabetes, people who are living with cancer, etc. If I have a pre-existing condition, as many Bahamians do, how do I fit in this scheme? I mean, once you have a condition, most, if not all, health insurance companies' policies will turn you down.
It brings me to two most important pillars of our national health insurance program we propose. That is one, affordability. Number two, shared responsibility. We looked at everyone will be contributing, so everyone will share in the benefits. And if everyone is contributing, it means that the costs will decrease considerably. That's number one. Number two, we apply that to our standard benefit package, an affordable cost. And in this standard benefit package, no one will be excluded. No one can be denied on the basis of pre-existing diseases. So that means that under the National Health Insurance Plan, that if you are at the age of 36, you might be nice and healthy now. You had breast cancer. You got treated, everything is done well. Now you are 45, you're 50, and you need health care. And they tell them, you just can't afford it.
Yeah.
You have a pre-existing condition. And that applies across the board to almost any of the high-cost disease. Well, in this standard benefit package, you will not be denied. And we have mandated that the employers should participate in contributing to the cost of the employee's healthcare plan, because employees are fundamental to their business. And the insurance companies, in participating, that they must assure to all of those in their plan, because we are saying that this 2% that you're talking about, I much prefer to say that this contribution to your health care is not being paid to government. It is going to be paid to the private insurance companies, so they have a responsibility.
I want to talk about that,
That's
and
right.
I want you to explain that. But first of all, when you talk about accepting people who have pre-existing conditions, insurance companies do not accept these people because the premise is they're going to put a greater burden on the system. So how now do you justify even that? Because those people or those individuals are going to be the ones who are going to need the services and will tax that or draw down on those services more than anyone else.
I have to make a comment here. This is fundamental to shared responsibility. The problem with healthcare is a mutual. It has a component of insurance to it. It's not whether you're going to get sick, it's if you're going to get sick.
Oh, well.
We are all going to get old.
Yes.
There a time will come when you will not be earning the money you have to pay for your premium insurance. Who's going to pay for that then? Okay, so we have to be in a position where the fundamental of insurance companies, and insurance companies know it, the fundamental insurance is that those who are well and healthy pay for those who are not so well and healthy. Now, so they spread that risk of costs of those who pay more. They pay more if you have more. But in our society, we are brother's keeper. We have to look after each other.
There are some non-contributing individuals as well who this plan speaks to. Children, retirees, non-working spouses, which I found very interesting. I want you to explain that, and underemployed. How are these people going to be factored into this plan?
So these people will access services through NHI because these are the individuals who don't have private health insurance either by purchasing it themselves or having it provided by their employer. And their employer may, for example, not cover a dependent spouse of a working individual. So those individuals will come to NHI. And I think it's important to note what that means is the resources that we're given by the government to deliver those services are now being focused on the people who most need it. And these, as you said, would be seniors, there'll be the unemployed, people who are unable to work, and the young. And they will have the same standard health benefit on the same conditions, but they'll access those services through NHI.
Could you explain non-working spouses and underemployed?
So we propose that the coverage would apply to the individual that works only, because we're also cognizant that this is a cost to business. As you mentioned in your overview, VAT has recently gone up, and this has to be affordable for everybody that's involved, not just the government. And so we wanted to come up with a package that was substantial enough to be meaningful for people, but affordable for the businesses in which they work. So we're not proposing that a spouse of an individual who's working gets covered today. Now, some employer plans do include spouses, and some individuals that are employed pay for their spouses. Those options will still be there, but in the event the spouse doesn't have coverage, they'll access the service through NHI, as would children that are not covered through their employer's plan.
And underemployed?
Well, underemployed, we propose that individuals who are working over 15 hours a week would have the insurance provided by their employer. And we've had some feedback about that number, and we welcome that because, we looked at the data, we thought that was a reasonable point to put out there for discussion. But that would mean that, the majority of part-time individuals would be included in the plan, but if they're not, they'll come to NHI.
Mm-hmm. Okay, so you mentioned that this 2% will not be going to government. And I think initially a lot of people were very concerned about that because they saw it as a tax, value-added tax goes to government. I mean, we pay national insurance out of our salary, it goes into a fund. But this now, you're saying will not go to government. So explain to me where my 2% is going.
What we are saying is that we want to ensure in our employer mandate that every working Bahamian will have health insurance coverage. Number one. How are they going to pay for that? We have proposed, looking at the cost of care today, that will be no more than $42 per person for the individual. Someone who is making $5, if they were making $5,000 a year, I think they might pay $7, $8 a month. Okay, so we are very cognizant of that. Now, that care, that funding is going to the insurance premium. So we are saying to the insurance, we need you to have programs that will include the standard package of benefits. Now that gives problems to the insurance companies because what we are saying in this standard package of benefits, there will be no co-payment, there will be no deductibles. Okay. Now, insurance companies, they estimate or they calculate that their insurance program will encompass people having a share in terms of co-payments, deductibles, and so forth. So they have to recalculate all of that. Secondly, we've also mandated that in this standard package of benefits, that at least 80 cents out of every dollar is going toward the healthcare services, not to administration and profits.
Will I still be able to use my private doctor?
If that wouldn't be an issue for us, because your private insurance company will look at whatever contractual arrangements you have.
If I decide to go with National Health Insurance,
absolutely,
I'll be able to continue to see the same doctor.
I hope so.
Will doctors have to be a part of a network? I mean, as it works in other countries where, you know, you have to select from a network of doctors or a network of healthcare facilities or medical laboratories. Will it be where, you know, doctors will be mandated to be a part of a network?
So right now, the model is different for private health insurance companies than NHI. We have 43,000 individuals registered today. And in our model, every individual that registers with NHI gets a family doctor. When you enroll, you get to choose from doctors that have available space and they become your family doctor. That isn't always the case with private health insurance policies. It gives you more options than that. You're able to go to a drop-in clinic and make a copay, or you're able to go to a regular doctor and make a copay. And we think the future probably lies more in the model that we have, because it establishes the concept of a relationship between a physician and a patient, and allows the physician to understand the patient and take responsibility for their care. So right now we envisage that the model that you have would continue if you chose to. But on the other hand, what we've seen so far is the model of attaching individuals to a family physician is very cost effective.
Now, one of the things that your proposal outlines is something called a sin tax, which to take effect in July 2019, a tax on sugary drinks, alcohol, and cigarettes to create an economic and social incentive to reduce consumption. Is that realistic? Will that happen? Will we see that?
Well, I'll say something. I let Mr. Bishmat follow up. Sugar has become the new tobacco. The evidence is very clear that a lot of our drinks that we have today are flooded with sugar. It is a primary cause for our obesity in the country and its sequel. It's also responsible directly as to almost 50% of our kids already being overweight or obese. And we feel that a tax will have two aspects to it. One, it will decrease sugar consumption, and two, in the funds that are collected will be used primarily in prevention and our wellness promotion programs.
So the taxes on those will be used for something specific.
And the current research on those countries that have already implemented the sugar tax, they have shown two very interesting outcomes. The first is that people actually decrease the amount of sugary drinks that they have, and they actually increase the amount of less sugary drinks.
I'm certainly not going to make a case for alcohol and cigarettes. I mean, it is what it is. But opposite that, I mean, when you decide to change your diet, to eat healthier, to remove certain things, and to add, more fruits and vegetables and other things that are going to contribute to a healthier body, you take on an additional expense. These things are expensive. It is expensive to eat healthy in this country. Is any consideration being given now to maybe even lowering taxes or eliminating some taxes on the more healthier food items? Because it's okay to bring in a sin tax, but if I could only afford, if I'm making minimum wage, there's some things I outright cannot afford.
I think that the National Health Insurance Act allowed me to talk about health, not the other taxes. You got the wrong. You got the wrong.
Well, I'm hoping. I would hope that as a part of the wellness discussion, that something would be put forth to the government to say we need to address this.
Having said that, in our role is that we are looking. In fact, we have already hired someone to look at quality assurance and how better our programs will be, with a particular focus on our wellness program. And we are looking to having incentive-based programs that will look at changing people's behaviors with regards to what they eat and how much they eat, and to be more involved physically with regards to exercise.
Drive those prices down. That's important. One of the key things with something like this is going to obviously have to be enforcement. If it's a 2% tax, if it's 2% that's coming out of my salary to go somewhere, I need to be assured that that money will go there. What is it? Is there any consideration being given to how you're going to police all of this? I need not even tell you at this point the issues that have ensued with national insurance and employers taking monies from employees not making the contributions. I mean, and then when you show up for your national insurance, it's, you know, you find out that it hasn't been paid for 6 months or a year, of people collecting and not paying, and having to go to court. And so there's already this debacle over there with dealing with just national insurance. So you're now putting into the hands of the employers another opportunity to take more money from employees, you know, and possibly pocket that. So how are you going to police that?
No, that's an important point, and we want to use the existing enforcement mechanisms that are out there. So as I mentioned earlier, all insurance policies will have to cover the standard health benefit, and I think the Insurance Commission will probably have oversight of that. And we've been talking to the Chamber of Commerce about how we can ensure that businesses that are required to provide insurance for their employees do so. Our original proposal was linked to getting the annual business license. And I think they quite rightly have said to us that you know, that sometimes it's hard to do business here. It's bureaucratic and complex, and they don't want this to be an additional layer on top of that, and we're listening to them. So what I've said to them is, look, we need to achieve a mechanism whereby employees who are contributing get what it is that they're contributing to. So we'll work with you to find a way to do it. So you know, we've listened to their early suggestions around that, and we're going to continue during the consultation period. What is important to us is exactly what you say, that if an employee thinks that they have an insurance policy and they're paying towards it, that they have access to those benefits.
Yeah. You mentioned the consultative period. 45 days is the time set that you have put out there in order to consult with the public, I think have town meetings, etc. Now on Wednesday, the Bahamas Insurance Association said that the timeline or the time rollout of this policy is unrealistic and not feasible, saying there are a number of fundamental issues with the framework proposed. Also, they think there should be more time, given the rollout is only 45 days from the consultative period. So they're asking for an adjustment. I mean, when you hear that, on top of people saying, oh, this is another tax, I can't believe it, we're going to be saddled now with something else we've got to pay for. You know, how does that affect your work?
So, I mean, I think it's worth, I think there was maybe a misstatement in their paper. The standard health benefit would not come into place for the private health insurance companies until January 2020. Mm-hmm. And the actual rollout period for transition will not complete until the end of 2021. So that's 3 years from now. What we were proposing was that NHI would introduce the standard health benefit early, so that doesn't involve the private health insurance industry. Also, the consultation period is not the only consultation that we're undertaking. We're consulting on the overall framework. The last time NHI was proposed, if you recall, there was a lot of discussion about what it would cost. There was a lot of discussion about how it would be paid. So we put out there a framework that says, look, here's how we propose to do it. Here's the benefits that people get. Here's how it could be paid for. What do you think? Give us your feedback. Then there's going to be more discussion, clearly, on the regulations and on the details of what gets done. This is just on the overall framework to say, have we got it right? What do we need to adjust before we get into the detail?
So there's more time to go. Gentlemen,
I just wanted to add one important thing that's missed out in this shared responsibility. What we are saying is that of your $42 per month that you are collecting, we are going to take half of that and assign it to a pool so that all those who are contributing funds will go into the pool. And it's this pool that we are going to be charging to use to pay for the high cost care. So it's like having one big Bahamian ASU, that the money is there, and when you are sick, it's your time to get your draw, and the money will be there. We are built on sustainability.
Okay, gentlemen, we are out of time for the segment. Thank you so much for coming and sharing with us this evening. This certainly has been very insightful, and I know quite a few people have tuned in to hear, and certainly I know that your work will continue. You've got lots more to do, and you know, I encourage people to become a part of the consultation process, whether it's visiting the town meetings or going to the NHI website and being able to give their comments, feedback, ask questions. So, you know, it's going to affect all of us. So I think it's important we all get in on the discussion. Again, thank you so very much for coming by this evening. Well, in May of 2017, the Christie administration introduced the enrollment and primary health care facility. However, that did not happen. So why has the opposition decided not to support this initiative? Well, we're going to ask that question and many more of our next guest, who is coming to represent the opposition views on the issue. We are going to take a quick break and be back with more on the record right after this.
Hi, I'm here to tell you about the fastest way to purchase the vehicle you want right from home.
With SBT Japan, we import used cars from Japan straight to you.
Car ownership doesn't have to be hard. Go to sbtjapan.com and sign up for free. Search for the car you want, place your order, and make a payment using any one of our convenient payment options. Once you pay the duty and tax to our in-house broker, we will clear the vehicle and even deliver it straight to your home. Sounds too easy? Well, shouldn't it be?
We are in our second season of On the Record, and we thank you, our viewing audience, for allowing us into your homes every Thursday at 8 p.m. We value your opinion, and we want you to be a part of our discussions. So make sure you follow us on Facebook and Instagram and comment on our exciting topics. Remember, it's all on the record. Welcome back. The Progressive Liberal Party will not support the 2% payroll tax increase proposed to fund the national health insurance. The PLP leader called it regressive and oppressive for Bahamians who already struggle with the high cost of living. I wish to welcome to the show now Damien Gomez, who represents the Progressive Liberal Party, and Rudy Dean of the Democratic National Alliance, former candidate for the party. Gentlemen, welcome. You're no stranger to this show. As I opened the show in the piece, I called it a political hot potato, because whenever you talk about NHI or health insurance, the monies have to come from somewhere, and it's always a struggle in discussing who is going to fund healthcare. Damien, I'm going to start with you. The national health insurance was something that was attempted under the PLP, started in some ways, but now we've gotten to the point where this government has brought a new proposal to the table, and the leader of the party says we will not support it. Why not?
His opposition to the described tax is predicated on the unprecedented 60% increase in value-added tax during the last budget. Obviously, the Progressive Liberal Party supports national health insurance. We introduced it in the House. In my contribution when I was in the House, I indicated that there is no such thing as a free lunch, and at some point someone has to pay the bill. It is in that context that I take it that the leader of the opposition has opposed the 2% payroll tax. It might be viewed in another context as a payment for services to be rendered in the event of illness. And if it is viewed in that context, it may be more palatable. Though we would call for the slashing of value-added tax back down to 7.5%, and a more prudent expenditure of government revenues. We've seen massive wastage, the purchase of Aulukaya and Freeport. We've also seen the purchase of properties for the post office the signing of contracts, increasing government's financial liability, and then all of a sudden the government says those two properties are not suited for the post office, and they then do a deal with one of their cabinet members, Mr. Simonet. These ill-fated expenditures could well have supplied at least $100 million of the $180 million touted as to be collected by the 2% tax. So it's a question of management of government's resources.
So the opposition is not to NHI; it is to this
to mismanagement of government's finances and its repercussions on ordinary people.
Rudy, what is the TNA's stated position on this, and what do you think should happen?
Well, you know, let's go way back. I remember when I was in high school, Sir Lyndon assembled a Blue Ribbon Commission to study this issue. And then Mr. Christie came to power. Well, when Sir Lyndon died, he said this was one of the last things that he wanted to implement. You know,
we've been talking national health insurance for 40 years, 40 plus years. Yeah.
And then Mr. Christie came to power, and he started the process. You know, he continued on that legacy, but he didn't finish it. And then he came to power again, and he started it, but yet didn't complete it. And so, national health insurance is something that I think nobody would have any disagreement with. You know, but what happens is that how do we implement it? How do we pay for it? How, you know, what all would we cover? And so, you know, those are the issues that, you know, I think at the core of the center of, you know, contention right now.
Based on what you would have heard in the previous segments of the show, what is the intended span of coverage? Who would benefit, etc. Based on that information, is there any objection to the plan itself and how they intend to cover, who they intend to cover?
Well, let me first start out by complimenting Dr. Roberts and Mr. What's his last name again? Wichan. It is a very comprehensive approach, and they've done a good job in terms of explaining to us how they come about with the final figures of $42 per month, and that's commendable. There's some areas that I would like to see changed. I would prefer, rather than having to pay an insurance company, to paying national insurance the money, so that there is an institution that already does collections from payrolls. There's a database there. You don't have to reinvent the wheel, so to speak.
Do you think people, though, will be comfortable with national insurance collecting the money, given some of the issues we've had with national insurance in the past?
Bear in mind, they have gone to court. Mm-hmm. They have collected from people. They do actually enforce the National Insurance Act.
Yeah.
And it is a system that is working. Whatever its hiccups are, their staff are doing a marvelous job at ensuring that that system works. They have a capacity for doing it, which we have already paid to have established. To ignore them and to start paying to a group of people who have not been the most cooperative in the discussion and implementation of national health insurance. Even now, they're giving the authority a lot of problems in terms of sharing information. And we, when we were in government, received information from accountants that indicated that insurance companies are currently gouging the public by charging 3 times what is normally charged in other jurisdictions like North America
I don't doubt that.
and Germany. Now, if they have shown a propensity to greed, why should I give them my money to hold for the government? If it is to be used in the way that is being proposed and as is mandated by statute, I would feel more comfortable giving that money to national insurance. And I don't apologize for saying it. It's just,
Rudy, what would be your alternative? From the party's perspective, what would you see as the ideal approach to this?
Well, first, we would need to have a lot more consultation.
So you don't think the 45 days is long enough?
No. I think there has to be, the time isn't really the issue, the collection of all the information, bringing everybody together, because like Gomez said, some of the parties still haven't, revealed everything yet.
But we've been discussing this from 1973.
That's why I say that's
how much more time we need?
Right. But time is of the essence, because what has happened is that we have an older generation of people, and that is going to increase the costs, the healthcare costs. And as time go on, it's going to be much burdensome, on the younger persons. And I don't think we have a large enough pool of young, productive people who would be able to pay for the older generation, of persons who, incurring so many costs. And so what I'm saying is that, time is of the essence, and a DNA government would put this in place, would implement, do the right thing.
All right, gentlemen, we're going to take a quick break. I want to explore that a little bit more, but we've got to take a break. Stay with us. We're going to be back right after this.
In the past, I've had a lot of issues with data service, drop calls. I was encouraged by a very close friend of mine to make the switch, and in doing so, my service has been impeccable. The data is very fast, it doesn't spool, it doesn't take long to load, so everything works beautifully. I like to know what my bills are, and it's important that I'm able to simply just pick up my phone and know what my bill is. The front line for the Valley Boys is comprised of about 200 members. It's very important because to be a successful leader, I need to be able to efficiently and consistently communicate with them. It works that way. It's beautiful. The data that you guys provide is flawless. I'm John Williams, chairman of the Frontline Dancers Association of the Valley Boys, and I believe in best.
And welcome back to our program. The Minister of Health, Dr. Dwayne Sands, said it would be a tragedy if Bahamians did not support this initiative. If it fails, he says there would be two options: close down the current national health insurance scheme or continue as it is with the present limited service that is not universal health coverage. Gentlemen, do you accept that we are at a critical stage in our development, that we do need universal health coverage for our people? When you consider the strain on the public facilities, the amount of people who may be dying or not receiving the kind of care that they need simply because they cannot afford it, are we at that critical stage now in our development where it is a must that we have universal health coverage for our people?
Yes, I don't think anyone would deny that there is a need for a national health care.
Do you think people understand that? Do you think the ordinary Bahamians understand or appreciate that?
I think they do, because every week somebody come and ask me to buy a cookout ticket.
Oh yeah, all the time. And sometimes you have 4, 5, 6 sitting there. You don't even collect.
Yes, exactly.
You don't even collect the food. You just
because
pay.
it's just a donation.
Yeah.
But we have to get beyond that. We have to. There has to be a better way.
It's not just a need. This is now a requirement for our community. I say that because our population is getting older.
And sicker.
Well, as you age,
Yeah, but
particularly
when you even look at the younger population of the people who have the non-communicable diseases.
yeah, but if you add to age obesity, hypertension, all of the conditions for a less than perfect health in your twilight years becomes a certainty. It is in that context that I believe the government agreed at the United Nations to the different goals with respect to sustainability. And universal health care is an achievable goal for us, but is also a goal that is shared with other countries in the world. We can do it by 2020, 2021. The time that was set for the sustainable goals is, I think, 2030. So we would be ahead of the curve by about 9 years. It's important that we adhere to this for our benefit, because we stand to gain in terms of productivity. We stand to gain in terms of the quality of life for our people. These are things that are well beyond nickel and diming.
But I have to ask you this: when a opposition leader outright says, "I will not support the payroll tax to fund this," it's already sort of laid out as a political divisive issue. But we sit at this table, and we all agree that it needs to happen.
Yeah.
How do we get beyond the politics of it to make sure that our people are getting what they need?
Yeah, it's so funny how politics works, because, when you're in the chair, you have the power to do what needs to be done.
The now Prime Minister in 2015 said he was not going to support an increase in tax to
He said the
support
same thing, but why do?
But okay, so go ahead.
So,
sorry.
it's amazing how that's how politics works. According to what side of what side of the aisle you sit on. You speak one thing today, but you say something else tomorrow. You do something else tomorrow. But we have to be consistent in our politics, and the realities are there. I mean, things have to be done, and so let's be real and let's speak truth to power.
Back to my point. Go ahead.
But the point that I made, and I made it in my contribution supporting the establishment of the National Health Insurance Authority, is that there is no such thing as a free lunch, and the service has to be paid for. Now, it can't be paid for by looking up into the sky, and someone has to pay for it. Now, asking the government to properly manage its resources and to desist from overtaxation is one of the functions of the opposition. We have gone on record as opposing the excessive increase of VAT. To add insult to injury, as it were, an additional tax would be untenable, politically and socially. There are a number of businesses that have seen a drastic reduction in their businesses and business performance. And now that we are on the subject of taxes, this sin tax that's being proposed for next year will have a debilitating effect on struggling restaurants, which are now faced with a 60% increase in their costs, their value-added tax costs on electricity, on water. They're seeing customers reduce their going out to eat as a function of tailoring their incomes. And you're going to add now to that a tax on items that are key to their
what is the answer then? Should this 2% that we're looking at come out of value-added tax? What is the alternative?
Well, that would be a start. But government has to realize that it too has a responsibility of making sure that expenditures are
Their
prudent.
pushback could be, well, the value-added tax has helped to reduce the deficit. I mean, we just saw a report this week where the Minister of Finance came out and said the deficit has been reduced.
But he's increased taxes by 60%.
Yeah,
Is it that much of a surprise that they collected more money?
You would hope the money would go.
But at the same time,
I just put it out there.
When the PLP was in power, I remember Dr. Perry Gomez saying that there has to be a way to pay for it, and one of the means would have been a payroll tax. So why run away from it now?
So now it's, again, you go back to your earlier point that it was, when you're in office, when you're in the chair, it is a different situation.
Well, there's a vastly different tax situation where VAT is at 7.5%, and government was making every effort to maximize compliance with the value-added tax regime, had actually succeeded to the point where Simon Wilson was credited with finding over $100 million in additional taxes that had not been expected. Government changed, and the benefit of that additional monies ought to have been there for the new administration to profit from it. They turn around and a year later increase taxes in that particular segment by 60%. Now, any objective onlooker would see that that is a major change in the circumstances of the political party that has made the statement that it has made.
Yeah, but
as I said, I support the report. I believe that it is a credible and excellent attempt at defining why it is that the $42 per month is needed. And if you want to have national health insurance, as we need to have it, then you've got to agree that it has to be paid for. And that mechanism, if it isn't going to be a payroll tax, it's got to come from either some other taxes or we've got to force people to pay insurance premiums to cover it. And I'm against that because I think constitutionally that's not supportable. But a tax in the form of a payroll tax is, or if you want to have a direct headcount tax, that's another way of dealing with it. But fundamentally, the public has had enough of the high taxation that has been levied by this administration. And I think that what the leader of the opposition was focused on was that particular issue and the really profligate spending that has been associated with this administration in recent months.
Really?
Yeah, what I was saying, the real issue is finding long-term solutions to our issues today. You know, and so we cannot be going back and forth and saying, you know, using Band-Aids, you know, to cure a big open wound.
Yeah.
You know, so you know we have to be real. We have to find permanent solutions to our serious issues.
Gentlemen, thank you very much. Unfortunately, we have run out of time in our segment. It's been a very interesting discussion. But what I would like to say that is encouraging is that when you hear support across the aisle for the actual initiative, and Mr. Gomez, thank you very much for saying that, because I think a lot of times we have a tendency to disagree just for the sake of disagreeing.
Well, bear in mind, when we set up the authority in statute, one of its primary functions was to determine what the costs would be, how that would reflect in the means by which we go about paying for the health insurance scheme. They've done that. And it can't be said by those who voted for it that we didn't expect them to say this is what the expense is going to be, and this is how we came to that conclusion, and this is what the cost of it is going to be per person, and this is how we came to that conclusion. That is a good point to be in. They have no political axe to grind. They're neither spokespersons for any political party in the country, and they looked at it from a purely data-driven basis.
Excellent.
That, to my mind, was intended by the statute. And having come to this point...
I want to ask you one quick question, though. Should the PLP not have brought this forward earlier in their administration?
I believe this should have been brought forward probably in year 3.
Just before the election was a little late, eh?
It was late, largely for political reasons. An attempt was being made to bring the insurance company on board. Well, that's an impossibility. And the sooner that the public realizes that you can't seriously expect a person to act against their financial interests. They've been doing it they've been sticking it to us all along. Why would they now stop?
Why change now? Gentlemen, I had to get that last piece, and thank you so very much. That brought a lot of clarity to everything. Thank you though for coming by and talking with us tonight. I trust that over the next 45 days, or even if they extend the consultative period, that these are the types of discussions we'll continue to have, and let's see what happens. As the authority has said, this is just a proposal. They have not gotten full cabinet approval, and even members of the cabinet have said, well, keep working, we'd like to see what you come up with. So let's see how it turns out at the end of the day. Gentlemen, thank you so very much for coming by. We hope that you have enjoyed tonight's show. But before we go, I wish to just take a moment to express our condolences on the passing of former PLP Cabinet Minister and Chairman Bradley Roberts. Mr. Roberts was a frequent guest of our show and in fact agreed to appear in one of our earliest episodes as a guest when we first began bringing these shows to air. On a more personal level, I came to respect the tenacity of Mr. Roberts as a politician over the years. Anytime I had reason to interview him, I had to ensure that I was always well prepared, and I certainly appreciated that. His death will no doubt be a great loss to the party and country. Our condolences to the Progressive Liberal Party as well as his family. May his soul rest in peace. Again, special thanks to my guests, Dr. Robin Roberts, Graham Whitmarsh, Damien Gomez, and Rudy Dean. On behalf of my producer, technical staff, and crew, thank you so much for watching. We'll see you next time.